Good evening, everyone. This is Dr. Yakub, and today I'm going to show you the glucometer and how to check your finger stick glucose using the glucometer. This is very important to guide the treatment of diabetes or pre-diabetes. And in this first video, I'll show you the parts and how they work together to check the blood sugar. This machine is called the AccuCheck Guide. Of course, the principle of how you check the blood sugar is the same across all machines, but I will show you in the future some other machines so that you can see the difference in technique. Inside of the box, you have a black holder or black box that has all the parts that you will need to check the finger stick. I'm going to lower this camera a little bit so that you can see all the parts and how we open this box and what it has inside. So to open the box, you have to press on the side knob to clear it, okay? And then it opens it up like this, and you have all the parts inside. So what do you have? You have the lancing device. This is the name of this pen here called lancing device, which uses the lancets, okay? You have the alcohol pads that you use to clean the finger before you check the finger stick. You have the glucometer itself that reads, and you have the test strips with which you're going to read. Now, let's unpack this and get all the parts out. This is the glucometer, lancing device. Let's get a lancet out. Let's get one alcohol swab out, and let's get the test strips box ready. Okay, so let's start. To clean the finger, we'd clean it either with washing with soap and water, which I did, by the way, and then drying it well, or by the alcohol swab. Where you clean is the side of the finger rather than the pad itself. And then you get the lancing device ready. To get the lancing device ready, you need to open the top like this, and now you need to insert the lancet inside of this hole. Now, this is the end of the lancet that will go inside, and as you can see here, it fits very well. Then you're going to turn the top so that the needle would be exposed. And you remove the top, of course. Then you secure it back by putting the cap back on. And now it is ready. But one thing I want to show you is on the knob, there are some numbers. And what these numbers mean is the intensity of the depth of the finger stick prick. Of course, if you have the thicker the skin, the more of the knobs you need to turn so that you can get a higher penetration. So here's, for example, this is the highest that it could go to 5. The lowest it would go is to 1. Some people think that mistakenly that if they put it on a lower number, that it will hurt less. It doesn't. All it does is that it doesn't make it penetrate enough, and then you would need to repeat the prick several times to get a result. A good place to start, if you're not sure where to start from, is to make it in the middle. So this one goes from 1 to 5. I will just put it at 3 to make it ready. And then you can, in future times, if you know that your skin is a bit more sensitive, you can use lower penetration, or if the skin is harder or has some calluses, then you need to do higher penetration. And to prepare this pen, now that the lancet is inside, you need to cock it or get it ready or activated by clicking here on the end of it. Now, notice what happens to this window when I do that. You see the window became dark or yellow, indicating that the pen is ready for pricking. If the window is clear, it means that it's not ready yet, that the device is not activated or cocked in place. All right. Now, about the glucometer itself, there are ways, of course, to open or put it on, which in this device is on the side. This button on the side is how you start it. But also, some devices, all it needs is for you to insert the test strip inside of the glucometer for it to automatically activate. Now, this is the box that holds the test strips. And these are the individual test strips. I'm going to show you, I'll get one out and I'll show you. The test strip has two sides, and that is true for all the test strips that you'll see. One of them looks like something electronic, something like a computer-like chip kind of thing, right? So that obviously has to go inside of the glucometer itself. And another side is for checking, and this side has blood drops on it, or the shape of blood drops, to indicate that this is the side where the blood goes. Now, obviously, just be aware that I'm going to actually be checking my blood, my finger stick. So if you're squeamish about it, you may want to just pause or, take a seat or something. I don't know. I mean, it's not going to be rivers of blood or anything, but just explaining what we're going to do. Okay, so then I have to put in this part of the finger stick test strip inside of this hole in the glucometer. And now see, the screen now changes to, it's waiting for the drop of blood. It's eagerly waiting for that drop of blood. Okay, now let's see how we supply it with the drop of blood it so eagerly wants, right? So I'm going to put the tip of that lancing device that is now ready on my finger, on the side of the finger, not the pad. I'll tell you why in a future episode. And then click on it. And now that got some blood out. Okay, so I'll hold this device to catch this drop of blood and get this yellow part of the device here, and see it got that drop of blood, and it tells me that the blood sugar is 105. All right, so we had a successful finger stick check. Now, to basically have something to clean the drop of blood, or to kind of make it dry, I have a paper tissue that I will use. You don't really need to be using a Band-Aid or anything like that unless you're constantly bleeding. But people who take a blood thinner or have a tendency to bleed more, the way that they should that they would do is to apply the pressure for longer so that the bleeding would stop, and only remove it after a couple of minutes or so. All right, so then I'm going to clean, of course, all of this by removing the test strip that I used. I can turn off the device now. I can clean all the other stuff and then put the box back where it belongs. Okay. And place the glucometer back where it belongs, the lancing device back where it belongs. By the way, for the next time that you check, you need to use a new lancet. Some people utilize a lancet more than one time, and that is okay if it's the same person. Of course, you should never use the lancing device of another person because that can transmit any blood-borne disease. So you just one person, one lancing device. Now, if you check the finger stick multiple times with the same lancet, what you'll find is that it hurts more on the second or third time that you utilize it, so you don't want to do that. And now that we have cleaned out everything, I'm going to just close the box, okay, and get it ready for next time. I hope this has been helpful for you to check the finger stick, know how to check the finger stick. And on future videos, I'm going to explain a few things about common mistakes with checking the finger stick and how to avoid them. I hope you found this video helpful. Please share, subscribe so that more people can see those videos, and see you in the next episode. Bye.